Hi, I'm Chad Myeroff, shoulder and elbow specialist with TwinCitiesShoulderandElbow.com. Here to talk today about a really common injury. Almost everyone has either had issues with their shoulder or knows someone who's had a rotator cuff tear. Rotator cuff tears are really common, they're really painful, and they can take you out of the game. So I'm here to give you a little overview about what your options are if this occurs, both non-operative options, injections, and surgical treatments. So ultimately, you can be the best prepared to make the best possible choices to get you back to where you want to be. Now, rotator cuff tears occur quite commonly. Most of the time, they occur with wear and tear over time. It's a combination of time, genetics, and injury. Now, there's 4 tendons. One's in the front called the subscapularis, and it is responsible for internal rotation of the shoulder. There's 2 on the top, the supraspinatus and the infraspinatus, and there's one on the back, the teres minor. Now, these muscles come from the shoulder blade, the scapula, where they attach as a muscle, and then they transition into a tendon, which moves the ball in different directions. Of course, the shoulder is also made up of other muscles, specifically big muscles like the deltoid, the traps, or the latissimus. So the rotator cuff is actually designed for very fine movements, positioning the shoulder in space so the big muscles like the deltoid can do the heavy lifting. Now, when these injuries occur, it can often cause pain with reaching overhead, in front of us, or very commonly night pain, which everyone knows when you can't get a good night's sleep, it can make the next day that much more miserable and disruptive to your life, and the cycle can continue. So the first thing we want to do is get control of your pain and help you get the best possible function. When a rotator cuff tear occurs, most commonly it starts small, and oftentimes they can get bigger over time. Rotator cuff tear cannot heal itself, but with therapy and sometimes an injection to bring down the inflammation, we can often control that pain early and begin strengthening the muscles around the shoulder to sometimes overcome these rotator cuff tears. The vast majority of rotator cuff issues can be solved by strengthening the muscles around the shoulder with physical therapy and get you a good chance of getting back to a high level of function. About 25% of patients, specifically those with bigger tears and more symptomatic injuries, will fail non-operative treatments and may require going on to more advanced techniques like a surgical repair. Most rotator cuff tears these days are fixed arthroscopically with a series of small poke holes around the shoulder. Now, that does require anesthesia and a trip to the operating room. The reason we offer that is it's the only way to get the tendon to actually heal down to bone, and it's the most reliable way to get you the best possible outcome. That said, rotator cuff repairs can be very successful, especially when done in the right setting with good healing capacity. The recovery on it is the biggest downside. Recovery is about 6 to 12 months, and it's important to know that going in. Now, that said, it doesn't mean you're not better than you are now for 6 to 12 months, but that represents your final outcome. The surgery is usually the same day. You'll usually be able to go home that day. I think it's really important before surgery to get fit with a sling, so it's just customized exactly to you, and also to have you meet with one of our physical therapists with something called prehab. Prehab is where you learn the ins and outs of your recovery before surgery, so you know how to best protect your repair. You'll have surgery that day. It usually takes a couple hours. Oftentimes it's combined with a couple other small surgeries, addressing some other areas like your biceps tendon, sometimes your bone spur called the subacromial decompression, or rarely a distal clavicle excision if you have arthritis in that area. But that said, the main focus is usually the repair of the rotator cuff. You'll go home that evening. There's a whole number of pain medications you'll take to kind of help decrease your inflammation and minimize the amount of narcotics you need, but usually some narcotics are used for a little while. It's important to me that you really understand how to best go through your recovery, and we spend a lot of time going over that. You'll be in a sling for about 6 weeks. The biggest trick is you're not allowed to lift the arm on its own power for about 3 months because that's how long it takes for the tendon to solder in. The repair techniques are simply not strong enough for immediate lifting of the shoulder. That said, strengthening will begin around 4 months. Around 6 months, most people feel they're about 80% function, and the goal is 85% function. Slightly after that, and up to 95% function at a year would be considered the average outcome. And the reality is, we want you to get as normal a shoulder as possible. While surgery does result in a longer recovery, it gives you the best possible chance of reaching that threshold. There are some patients who, for whatever reason, whether it's been torn too long or torn too massively, there are certain situations where repair is not the best option. It's really important to meet with a specialist who takes care of the whole gamut of shoulder injuries to best understand if one of those options may be needed for you. Some of those include muscle transfers or even a reverse shoulder replacement, which can be done down the road in the setting of very severe rotator cuff injuries. It's important to understand that every patient and every sports injury to the shoulder is different. Every rotator cuff has multiple options, and it's all about getting you the right option for you and the best chance of getting you back to the sports and lifestyle that you want. Please see us on TwinCitiesShoulderAndElbow.com, book an appointment virtually or in person so we can better get an understanding of how to get you back on the field.